I'm Angie Kleinhalter. I work for Kimball International, National Office Furniture, a brand of Kimball International, and I am the Director of HR.
Perfect. And then can you tell us, why did you come in to see Dr. Riecker? What problems did you have?
Yeah, so I had 2 meniscus tears in my left knee, and so did have surgery on those. They were tears, so there's only so much you can do, but I wanted to stay healthy and active and do what I could to, recoup and get back to feeling good.
Perfect. And then could you say what your pain level was before you came in?
It wasn't so much about pain as it was maybe discomfort and how it felt kind of worn out and tired at the end of the day and inflamed, kind of like I walked just on one leg all day type of feeling. It wasn't really pain. But I knew that it wasn't right and I needed to do something about it.
Yeah, that's good. It's very proactive. So did you consider doing, I know you said you had the meniscus tears, which like you said, there's only so much you can do for things like that.
Right.
But did you consider doing anything else in the medical route that you decided against?
Not necessarily. I did have surgery both times. But after that, no, I didn't. I just kind of felt like this was something I was going to have to live with.
Oh, wow. And then, so what did Dr. Riecker do to help you with the problem?
So he was working with a company, remind me the name.
Regenerative medicine, yeah.
Regenerative medicine, thank you. And, talked to me about doing it, what the pros are. Can't really think of a whole lot of cons to it. And so I thought, kind of, why not? Give it a try. It can only help.
Sure.
So I'm one that will try things to make sure that my body can function as best as it can. So I was really all in when he talked to me about it.
Awesome, great. And then what results did you get? How did you begin?
Yep, so I had the injection in the knee, and so the program after the injection was, I'm an avid exerciser, so really no exercising, and then kind of let the stem cell do what the stem cell needs to do, and then slowly get back into exercising, which is really what I did. I kind of listened to the program and made sure I was doing everything he told me to do. And probably about 6 weeks is when I started to feel a difference, like, okay, I think this is starting to work. And by 8 weeks, I could kind of confirm that I felt different. And again, I can't even talk about the pain level, but it was more about how my knee felt at the end of the day.
Yeah.
And my knee felt, whether I worked out or not, it felt the same. I think it's just because of the long hours, up and down, and just normal activity. But I can definitely tell at the end of the day, it feels much more normal.
Yeah, so how would you compare it to your other knee now?
I would say pretty comparable, yes.
Pretty close?
Mm-hmm.
Good.
Definitely.
Awesome. Perfect. And then can you just give us a brief story of like what your worst day would have been like before the procedure?
I would say from a workout perspective, feeling like I guess a little apprehensive to even work out, and if you're lifting, making sure that I wasn't lifting too much and that type of thing. And not that I'm overdoing it now, but I do feel more confident that it has improved and that I can, challenge myself to an appropriate level. And again, at the end of the day, it wasn't a good feeling, as well as the other thing I didn't mention that I can't confirm yet, but I can in the future, is just jogging. Whenever I jogged, there was always this catch that I could never get that full extension, and I feel better, and with the weather I haven't been able to really test it out, but I'm excited to do that as well.
Well, you'll have to let us know soon. Perfect. All right, great. So I think that should be good for now.
Okay,
Thank you. That was perfect.